and welcome to Q&A with CNA. I'm Kyle Schwartz, and my guest for this segment is Dr. Colin Christensen, and we're going to talk about some things coming up. But first, we're going to talk about your background a little bit. You were here at Christmas time last year, and but let's refresh people about your background, where you grew up, where you got your degree, and that type of thing.
Certainly. Grew up in Metro Detroit. For undergraduate school, I went to Texas Wesleyan University in Fort Worth, Texas. From there, I went to graduate school at the University of Akron, got my master's and PhD in counseling psychology. My internship, I went back to Texas and went to Dallas Child Guidance Clinic, and I've been with child and adolescent for about 15, 16 years.
Okay, wow. Do you miss Texas at all?
I miss it in the winter. I'm not a huge fan of cold winters.
Not so much in the summer, right?
Right, right.
All right. So when you were here last time, you get to work with the doctoral intern staff, and so 4 come in every year, right?
Correct.
All right. So what does it look like for those interns? What does their year entail?
Sure. Well, typically they're coming from across the country, and so they'll come in, and they're just starting now, so they'll do a week of orientation. Then we have a month of pretty heavy training, and from there they'll slowly pick up a caseload, and typically they'll be trained throughout the year and usually stay for about a year. Sometimes we'll get someone who'll stay for postdoc, but it's a real good experience. It's great getting to meet new people.
Okay. So as the supervisor of this program, what's the most rewarding part of that job?
Just seeing them grow over the course of the year, knowing that there's 4 people who come across from the country who are in a vulnerable state, and knowing that I have something to do with helping take care of them.
And what do you find with these interns is the biggest adjustment for them, or the biggest shock about what goes on there?
Sometimes it can be just a big adjustment coming to a different part of the country. So we've had interns come from California, Massachusetts. We had one last year from Hawaii, and so just experiencing a different part of the country, being away from all their social supports, friends, it can be a big adjustment at times.
All right, so since you only have 4, you probably have quite a few though that apply, right?
We
How do you
do,
select them?
probably around 80. We have 80 apply.
Wow.
From there we do 25 interviews. From there we narrow it down to we rank them 1 to 25, and then they choose where they'd like to go. They typically apply to 10, 15 places as well.
Okay.
And so then we're matched.
Okay, all right. And then also part of your job entails helping to write grants and RFPs. So how does that work help the agency and various programs that you offer?
Good question. We're very fortunate to have a number of community partners. One of them is Stark-Mar. They're the local community mental health board, and they fund us to the tune of, I believe, $1.5 million. And they want to make sure that we're wise stewards of their money, and so they have us apply for the grants, and then they will develop some outcomes that we strive to achieve. With that, we're able to get, for example, school-based consultation, where kids can be seen in the school for up to 3 sessions, free of cost. They also help to provide funding for clients who otherwise wouldn't be able to afford our services.
Yeah. Okay. All right. Those are good programs. And also, part of your role is analyzing data and numbers, which a lot of us are not into. So how do they utilize the data that you collect and decipher?
Good question. They want to help to make sure that we're doing a good job. And so one of the things that we might look at, for example, is wait time to receive services. One of the main points of emphasis now is we want to have good access, that when clients call, they're able to get in, get services quickly and efficiently.
Yeah.
So that might be one of the things that we track, and then we try to find out, are we improving? Are we, perhaps plateauing? What can we do to improve?
Okay. And was there anything else that we missed that you wanted to add? I mean, it sounds like you cover a lot of areas with your job.
Oh, sure. No, one of the biggest things, just, if you know of someone who needs help, child or adolescent, you can always call Child and Adolescent. Our phone number is 330-433-6075, and we'll do whatever we can to try to help you.
Okay. Well, thank you, Dr. Christensen. Thanks for being with us.
Pleasure.
And thank you for watching Q&A with CNA. I'm Kyle Schwartz.